Hello, team. In this video, we will cover the 6 rights of medication self-administration, the importance of witnessing residents taking the medication, how to properly document medication refusals, and understanding PRN as needed medications. Let's get started.
Right resident. Always confirm identity using the name on the medication. Right medication. Verify the medication label matches the order. Right dose. Ensure the correct amount is given. No more, no less. Right time. Ensure the medication is taken at the correct scheduled time. Right route. Ensure the medication is taken the correct way, oral, topical, patch, etc. Right to refuse. Residents have rights to refuse medications. Staying with the resident. It is important that staff remain with the resident until the medication is taken. This ensures the medication is actually taken and prevents hiding, spitting out, or discarding medication. This also helps prevent a resident from taking another resident's medications.
Now that we've gone over the 6 rights of medication self-administration, let's learn about medication refusals and how to document them.
Residents have the right to refuse medications. We do not want to force the medication on the resident. However, we do want to attempt to offer the medication at least 3 times. If the resident refuses a medication, report the refusal on Slack. And of course, always place refused medications back in the medicine cabinet. Here is an example of what to do when a resident refuses medications. If a resident refuses a medication, ask them why they are refusing it and attempt to explain the medications to them. If they continue to refuse, take the medication away, lock it back up in the locked medication closet, and in 5 to 10 minutes, offer the medication again to them. To remind you of the second attempt, go to the iPad and set an alarm for 5 minutes. If they refuse the second time, take the medication away again, lock it back up in the locked medication closet, and offer it again the third time in about 5 to 10 minutes. To remind you of the third attempt, go to the iPad and set an alarm for 5 minutes. If the medication is refused the third time, lock the medication back up in the locked medication closet and report the refusal on Slack. Here is an example of what you should put on Slack after a refusal. Resident refused morning medication. They said they did not feel like taking it. I put it back in the medicine cabinet. PRN medications. PRN stands for As Needed Medication. These are not given on a schedule. Instead, they are given when a resident asks for it. Before giving a PRN, inform us on Slack what medication the resident is asking for or what symptom they are expressing. Send a photo of the PRN medication card in Slack and wait for a field supervisor or administrator to confirm. If a resident is asking for a pain medication, you must include what pain level the resident is experiencing. Ask the resident what is their pain level from 1 to 10. 10 being the worst pain and 1 being the least pain. Here is an example of what the Slack message should say. Mary is saying she has pain in her left leg and wants a Tylenol. Her pain level is 7. Can we give it to her? Also make sure to send a photo of Mary's PRN Tylenol card. Medication cards. Medication cards look like this. The card has numbers starting from the highest number and ending at the lowest number. When a medication is popped out of the card, you need to start at the highest number. The reason is because the numbers on the card are actually counting down how many pills are left in the card. For example, here is a medication card you may receive. As you see, the highest number with medication in it is 31. This is where you should start the card. We never want to start the card at 1 or at a random number. This helps us know when the medication is running low and when it is time to order.
It is important to follow these directions during assistance with self-administration of medication. Always follow the 6 rights. Stay with the resident, notify on Slack of any refusals, and ask on Slack before self-administration of any PRN medications. Thank you for your attention.